let's look at tetanus or lockjaw. This is a neuromuscular disease, and oftentimes it's called lockjaw because it affects your jaw muscle. It's produced by Clostridium tetani, and you find this in soil and in gastrointestinal animal tracts. The spores usually enter the body by an accidental puncture wound or a burn, or the umbilicus, or frostbite, or when body parts get crushed. And vegetative cells need an anaerobic environment to grow and release their toxin. The neurotoxin is called tetanospasmin, and it causes paralysis because it blocks motor nerve endings, and that prohibits the release of the neurotransmitter for muscle contraction inhibition. So your muscles contract uncontrollably, all of your muscles, including your breathing muscles. So death is often caused when these respiratory muscles become paralyzed. You can see this in this infant here. He has neonatal tetanus. And you see how his muscles have contracted. You find it more often in geriatric patients and IV drug users. The treatment is aimed at trying to limit the degree of toxemia and infection. And the antitoxin therapy uses human tetanus immune globulin, TIG, and this inactivates the toxin that's circulating, so but it doesn't interfere with whatever's the toxin that's already bound. You can use penicillin, tetracycline, and muscle relaxers. And there is a vaccine available, but we need to remember that we have to have a booster every 10 years, whether you think you need it or not. Now, clostridial disease, most often called C. diff or CDI, is the second most common intestinal disease. Salmonella is the first. It's caused by Clostridium difficile, and this lives in our intestine in low numbers. But it produces enterotoxins that damage the intestines, and it's a major cause of diarrhea in hospitals. Those of you that are already working in healthcare, you're familiar with C. diff and how difficult it is to control. If you are on antibiotics, broad spectrum antibiotics that'll kill other bacteria, the C. diff will multiply out of control. And a lot of times you can treat it just with more fluid and electrolyte replacement and stop taking the antibiotics. But you may need to be treated with vancomycin, or the metronidazole can also be used. And you can see here what it looks like in figure B in the intestine. There's two species of Clostridium that cause food poisoning, Clostridium botulinum and Clostridium perfringens. Clostridium botulinum is rare, and you usually get it from home canned food. And the Clostridium perfringens is a mild intestinal illness, and it's the second leading cause of food poisoning. Now, botulism, this is inadequate food preservation, and it's caused by Clostridium botulinum. This inhabits soil and water, and it's a spore-forming anaerobe. And the spores are on the food when it's gathered and processed. And if you don't get that food to a high enough temperature and pressure so that the spores can be evacuated, then they're going to still be there. And you're going to seal it up in a canning jar or a can, and the anaerobic conditions favor more spore germination and vegetative growth. And this botulinum toxin will be released. Now, it has no taste and it has no smell and it doesn't have an appearance that makes it look different. But it gets carried to the neuromuscular junctions and it blocks the release of the acetylcholine that you have to have for muscle contraction. You're going to have double blurred vision, difficulty swallowing, and other neuromuscular symptoms. So when you open a can or a jar, the jar should pop, showing it was sealed properly. The can should suck in air. If it spews out, then throw it away. Don't eat it. If the jar doesn't pop, don't eat it. Throw it away. We opened tomato juice one time and it spewed out of the can, so that one went in the trash. We poured it down the sink, threw the can away. Now, infant botulism is the most common type of botulism in the United States. And the infant's intestine is so immature, and the microbiota that are residents there are not well established, so it allows the spores to kind of get in and populate and germinate and produce this neurotoxin. And it results in what's called floppy baby syndrome, where they're very flaccid and paralysis. Wound botulism is when the spores enter the wound, and it'll cause food poisoning symptoms. And you see this a lot in IV drug users. Now, to treat it or prevent it, of course, we've talked about making sure that your food is sealed, the cans and jars are sealed properly. You can give an antitoxin, maybe even cardiac and respiratory support. You can treat it with penicillin. Now, Clostridium perfringens causes gastroenteritis, and the spores contaminate the food that wasn't cooked thoroughly enough to destroy them, and they germinate and multiply. You can refrigerate to control this some. So when you consume it, the toxin gets produced in the intestine, and you're going to have acute abdominal pain and diarrhea and nausea, but the recovery is very rapid. The action of the botulinum toxin is on the neuromuscular junction.